Welcome to the NEI podcast. On this show, psychiatrist, psychopharmacologist, and mental health advocate, Dr. Andrew Cutler sits with renowned mental health experts from a range of backgrounds to discuss breakthroughs and best practices for treating patients with mental health conditions.
Hello and welcome to another NEI podcast. Today we have a topic that I find personally very interesting and two issues that people may not associate as much together. And with us we have Dr. Robin Cooper, who is someone who has been working in this field for quite some time. She's joining us not from her usual home of Northern California, but in the beautiful location of Montana where her daughter lives. So Robin, welcome.
Thank you for having me here.
Well, it is really a pleasure. And how about if we just start out asking a basic question here? People who are listening to this, I'm sure, are mental health advocates, and I'm sure they're concerned about climate change. Help us understand how the two relate to each other and maybe how you became interested in this interaction.
So, first off, I am a psychiatrist, but how I got interested was not initially from my professional hat or my even understanding about the intersection of climate change and mental health. It came from my learning about climate change and then becoming much more involved in political advocacy in regards to policies around climate change. But I quickly discovered that I could probably be more effective if I used the things that were close to my professional understanding. And so I started to work in the area of health impacts of climate change. That led me to discover that many people who were talking about health impacts at that time, and this is over 10 years ago or so, were tacking on at the end of a talk about cardiovascular or infectious disease or nutrition. Oh, by the way, there's some mental health impacts.
Yes.
And I was first just ashamed. We mental health people, we psychiatrists need to be saying that, not just tacked on. And we need to have our voice there. And at this point, there was much less understanding about the intersection between mental health and climate change. And that has just exploded over the period of time that I've been involved in this. But when I start to talk about this, the scope, the very vast scope of mental health impacts on climate change, I start by saying it is not just that we feel bad about the world that we live in. That's a component in this field, the things that are now so widely talked about in media about eco-distress or climate grief or climate anxiety. But there's an enormous impact of climate change on brain function, mood, behavior, and both individual and community mental health. So it's a big field, and anything that we're going to talk about today could have a very large and deep conversation. When I think about it, we all have to have schema in our minds to organize our ideas, but I think about these as in buckets of impacts from climate change. Those that have to do with heat, and both the heat that changes our world gradually, but extreme heat waves. That has very significant impacts on violence, suicide, impaired cognition, impaired sleep, and then the medications that we use in psychiatry can impact thermoregulation and impair our body's ability to stay cool. So just heat alone can have many impacts on health and well-being. Then if we think about disasters, we all know disasters are horrific for mental health functioning, both at individual and community levels. And that can go from anyone exposed to any kind of disaster having distress symptoms or, things that get us upset during the disaster. It can lead to impaired ways of coping with increased drug use, alcohol use, isolation, and all of those kinds of behavioral ways of coping with stress, with disasters. And then a smaller subset, not everybody, but a smaller subset can come out of disasters with very profound psychiatric and psychological impacts with post-traumatic stress, grief, complex grief, depression. And now, with climate change, we're not talking just about one disaster. We're talking about the foundation of the communities that are impacted, that are already suffering often, and then layering on that lack of resources, and then multiple disasters, cyclical disasters that people are sometimes exposed to, and no disaster is limited to just that event. Disasters beget new and aggravated disasters. We can go on and talk about that a bit more. Then another area to consider is what's happening with displacement and migration, and what's happening in this world where we have less habitable space. And so those impacts on communities and individuals when they're displaced, and that can be temporary, it can be close by and near, or it can be more permanent and across long distances. So displacement's another big concern. And of course, that connectivity with communities that are disrupted. And then that thing that I started with, eco-distress, or those big feelings that we experience in this changing world that we live in. And that's a whole nother series of ways that we can think about the mental health impacts of climate change.
Well, thank you. My goodness, what a tremendous comprehensive answer, and so many places I'd like to go with this. But let me start with something you said towards the beginning there. I guess for me and probably a lot of people listening, the concept you mentioned of eco-anxiety, eco-distress, and the psychological impacts are what I first think of. But when you talked about all of the other biological, the societal, institutional types of issues, displacement, migration, there's so many aspects of this I hadn't even considered. So there's so many different ways to go here, and so many different places where we as mental health professionals really not only can, but sound like we need to be involved and need to be intersecting here.
Yep. The climate crisis is a health crisis, and it is a mental health crisis.
Yes.
And if we are going to be the mental health professionals of this 21st century, we need to understand one of the most profound threats to health and mental health. And we need to understand that both in our own experience with our patients, those who we take care of, and we need to understand also how that impacts broader society. And it's incumbent on us to be the leaders in the 21st century, to be experts about this.
Absolutely. And I think, first of all, we need to recognize the legitimacy of this issue for ourselves and then, of course, in our patients who bring these issues to us. I wanted to maybe break this down a little bit by bit. One of the first things that occurred to me as you were talking about this was how certain segments of our society are even more vulnerable than others. And I think, of course, people of lower socioeconomic status who can't necessarily move that easily or don't have the resources must be particularly affected. Would that be true?
Absolutely. Absolutely. And when we think about all of those domains that I talked about, every single one of them is aggravated by what we think about and talk about under the social determinants of health. And there are particularly vulnerable populations, but it is absolutely clear that poverty and lack of resources are the most determinant variables in terms of the disparity of experiencing the impacts of climate change. Now, none of us are going to get out of jail free on this. We're all going to have some impacts. But it is very clear that those with the least resources, and often those who have contributed the least to creating this problem, are bearing the first and the most significant impacts. And that's true in our communities domestically within the United States, and it's true internationally. And just to put this in perspective at this moment in time, you and I are talking right while the COP28 meetings are happening in Dubai now, that international meeting where leaders are supposed to come up with some solutions to the climate crisis. We'll see whether that emerges. We need some healthy skepticism as we understand the powers that be. But it is this year that attention to the disparities, particularly in the global South, have been a focus of some of the discussions at the COP28 meetings. And that's true, as I said, internationally, where the global South bears the greatest burdens. And it's true in our own communities, where people with least resources, low income, and particularly communities of color bear
Yes.
the greatest.
Yes, unfortunately.
Now, let
that
me
is
go
true.
on, though. Those are not the only vulnerable communities.
All right.
Those at the extremes of age, so pregnant women,
Yes.
children, youth, and then the elderly are
Absolutely.
particularly vulnerable to some of the aspects of climate change. And for elderly, these can have also interconnections with poverty, since many elderly live on fixed incomes.
Yeah.
But also, first responders are also a vulnerable community. Those who
yeah.
live close to the land and where
Right.
that land is changing dramatically are important people to consider. And I
Sure.
would be remiss if I did not underscore that the mentally ill, and particularly the severely mentally ill,
Yeah.
are very vulnerable
Yes.
and die at much greater numbers during extreme heat than those without severe mental illness.
Wow. Wow, a lot to consider there. And certainly in your home state of California, the fires that have been happening lately. My sister lives in Southern California, and I know we worry for her safety all the time. And then here
Um,
where I live in Florida, as you and I had talked about earlier, we've got hurricanes and much more storms than usual happening.
Absolutely. Then those are the aspects of disasters. And disasters, we can think about disaster response globally, but disasters happen locally. And so what you experience in Florida is different than the kinds of disasters I'm going to be exposed to in
Right,
California or the
right,
West. And
right.
you've identified wildfires are a example of some of the ways of thinking. We've always had wildfires, and
Right.
the complexity of the huge wildfires are
Yes,
multidimensional,
yes.
but climate change is one of those. And it is impacted by the chronic drought, which is a long-term impact of climate change,
hmm
and then the acute events of extreme heat.
hmm
Then, when we have these disasters that have wiped out communities and, of course, displaced people, we're
Yes.
thinking about the residual impacts of
hmm
community dislocation, the trauma of the fire, the loss of income to individuals and communities, and the loss of life.
hmm
The people who have died mostly in wildfires are the elderly. And then the secondary impacts of wildfires on air pollution, and how air pollution is a secondary impact with vast impacts on the brain itself and our ability to think. Air pollution impacts and aggravates and is what we call a multiplier of significant neurodegenerative disorders.
I'm sure.
And then the example of a disaster not staying localized. We've
hmm
all seen these news reports of the air pollution that came from Canada's
Yes, that's right.
wildfires this
That's
last
right.
year that spread to the East Coast.
That's right.
And, views of East Coast cities
Hmm.
with massive air pollution. So the impacts have many tentacles.
Yes, and I think the point you just brought up, and I meant to say this, it's not just a coastal problem. I don't think anyone is immune to this. We've seen examples of massive flooding happening in the middle of the country, for instance. You talked about the air pollution effects. What's particularly, I think, terrifying for a lot of people is the unpredictability of these things and how it's very difficult to control these things. I mean, certainly the fires, it's so scary, you don't know which direction it's going to go. For us with hurricanes, we have many examples of a hurricane heading right for us that turns at the last second, and so it hits somebody who wasn't being warned necessarily.
Yep.
So the unpredictability is another factor of this that I'm sure contributes to the anxiety.
Absolutely.
Yeah.
And we're all we now are thinking about our seasonal vulnerability and being prepared for potential disasters
Mm-hmm.
and how to have our go kit if we need to leave, or being attuned to the warnings that are so important to prepare us.
Yeah. Let's talk a little bit more about specifically anxiety and depression. We've already talked a little bit about some of the ways that these things, the climate-related events, let's say, contribute to the rise in anxiety and depression. Of course, this is piggybacking on top of the significant rise in anxiety and depression that happened with COVID, with the pandemic. Are there common kinds of patterns or symptoms that emerge, and how should we in the mental health field try to address this?
I think that's an interesting question. First off, you connected this with COVID, but I kind of think about some of the stresses that we're experiencing in our world, that we're kind of living in a historical period of multiple challenges and multiple threats. I think about it, we're living kind of in a tattered world. And climate change is important, but it is not the sole things that we are living through or responding to. It is connected, and I think vitally important. I think it needs to be thought about as the existential threat that we are living through, but not alone. And it kind of feels like we're being bombarded from multiple directions with the kinds of things that we're living through. And we're seeing that, as we now say, there is a mental health crisis. And it troubles me in a way to think, oh, now that everybody's so distressed about the very real threats in our world, we mental health practitioners are supposed to come in and save the day with our clinical tools. We'll make people better. That being said, the distress that we are feeling about climate and the other ways that our world is tattered are not pathological.
Okay.
We are supposed to feel bad when there are real threats. And it is not abnormal, it should not be considered pathological to experience worry, sadness, grief, anger, a whole host of feelings about what we are experiencing now. The issue for clinicians, because we have to keep our clinical hats on, is when those experiences, when those feelings exceed a manageable level for us to function and also mobilize our distress feelings for appropriate action to protect ourselves. So it's not that when someone is distressed, we see anxiety or worry or sadness or depression or grief in any other ways than we do about anything else. It looks the same. It's what contributes to it. And if those feelings become so big that they are overwhelming, they are intrusive, they interfere with our thinking and behavior and modulation of feelings, then it becomes a clinical situation that requires, more of our professional tools, but not professional tools to obliterate
Right, right,
troubled feelings.
right.
It is really tolerating the troubled feelings in a way that my colleague, Janet Lewis from Climate Psychiatry Alliance, says
Mhm.
that allows us then to lean in, to be with, to not be at the extremes of both suppressing and ignoring or
Right,
being flooded,
right.
so that we can actually mobilize for effective engagement and activity in solving real problems.
Well, that is so well said. I really can't emphasize how well said that is, that in some ways these feelings can be normalized to a point. As you said, we have emotions for a reason. It's normal to have certain emotions, and it's a matter of, are they commensurate or appropriate for the situation. And it's only when they become intrusive, as you've said, or have some impact. But that's a really helpful framing, I think, for a lot of mental health professionals who might be listening to us talk today.
Mhm.
Also, I can imagine for a lot of mental health professionals, our job isn't to stamp out emotions, it's to work on coping and quality of life. And you said something earlier about unhealthy coping mechanisms. And I think situations like this probably exaggerate and bring out these in a way. Substance abuse, violence.
Yep,
You mentioned isolation. We have an epidemic of loneliness in this country,
absolutely.
as you know. The Surgeon General released a report on this. And of course, we didn't even talk about various societal forces such as social media and things like that that divide us, the breakdown of a lot of institutional structures that previously helped with all of this.
Absolutely. And that isolation and stewing in our own juices
Mhm.
about worries about climate change and the other kinds of things that we're dealing with is absolutely detrimental, both to being able to tolerate the feelings and modulate them,
Mhm.
and also being able to engage with others around real things that we can do.
Right.
I heard recently that despite all of our interconnectedness on social media and you
Mhm.
and I talking across the country to each other,
Mhm.
that actually youth feel extremely isolated and lonely. Now, maybe that has some
Yes.
secondary impacts of COVID and that isolation, but being disconnected in the realm of the climate crisis is horrific, and we need to come together.
So, I've thought about this, that it seems we've evolved to communicate in person. So much of our communication is nonverbal, and in social media, of course, it's mostly just verbal, if you will. It's print, and so much of communication is lost. And I think being in the room with people, being around other people is so vital for our physical and mental health. So I think this
Absolutely.
also contributes to the problem. You know.
Being physically with people makes a really big difference. Being able to see each other makes a really big
Mm-hmm.
difference. And being able to share with each other experiences makes a really big
Mm-hmm.
difference.
Yeah, I agree. I agree. The idea of a shared experience, is so critical, and peer experience, a feeling like you're not alone, you're not the only one, if you will, is a very important concept, I think, in working in psychiatry, working in mental health in general, not just around this concept.
Right.
What are some of the potential long-term psychological and even physiological effects of us living through this environmental crisis that we're in, the extreme weather events, and how can we adapt, adjust, and deal with that?
Well, the climate issues have both acute
Hmm.
impacts and then those long-term impacts, as you're saying. The acute impacts more related to, extreme heat periods and acute disasters. But long-term, what is it like to live in a world that is changing and becoming less habitable? We know that drought has a huge impact on the ability of communities to stay in the places that they are, to provide food,
Right.
to be able to be nutritionally healthy.
Hmm.
And lack of nutrition has major impacts on children's development and brain development
Hmm.
and a healthy mind and body. The vast changes to, as I say, nutrition and the nutritional value in food that is changing because of carbon dioxide in the atmosphere, infectious diseases that have significant impacts and can on brain function, and then those long-term kind of impacts on mood and depression.
Hmm.
And as I said, the experience of being demoralized
Hmm.
in a sense of what the world will be.
Right.
And that brings
Right.
up for me one of the most significant survey studies of youth and youth experience of distress. Carolyn Hickman's survey of 10,000 youth
Hmm.
in 10 different nations. And really, this was a very significant study in its granular survey impacts. None of us were surprised that youth are saying that they are very distressed. But the number of youth actually saying that they don't feel that they have a hope for the future and feel hopeless about the world that they're going to live in. The
Hmm.
number of youth who said they have intrusive experiences in an everyday way in how they experience their lives now. Their distress and their sense of hopelessness and
Hmm.
anger at those leaders who have come before them,
Yes.
particularly governmental leaders, and their distress about solutions from people who make policies was
Hmm.
very profound.
Hmm.
The youth are kind of telling us, wake up. And there are
Hmm.
more and more youth now, and we don't have any data about this, but who are saying they don't feel that they can have children.
Oh my.
And we don't know like the numbers of those,
Hmm.
but that there's a sense of, I can't bring children into this world that I don't think will be a good enough place to live.
Hmm.
And I can't bring children into the world if I don't feel like I can protect them or if they will contribute to more carbon emissions. What's that like for our youth to give up dreams of what their hopes were for being adults
Hmm.
and being parents?
Hmm.
That's very sad.
Well, it's certainly very different from when you and I were young. These were not at all considerations or thoughts that I was having. I know for sure. And when you speak of, it's not only hopelessness, it's a feeling of helplessness. You mentioned demoralization and helplessness. And certainly the alarm has been sounding for years, and it's been getting more and more. The red light has been flashing faster and faster. And you're right, I can imagine, and I certainly feel frustrated that our leaders haven't taken this more seriously and more hasn't been done up until now.
And again, I'm going to bring up on the international stage right now at
Hmm.
COP28, this is one of the largest meetings that
Mm.
bring together people from all over the world. And
Mhm.
this is the second year that there's actually attention to health and mental health there. And we have people, we have our colleagues who are there talking about mental health.
Mhm.
And youth are being mobilized at Dubai and at the COP meetings. And the contradiction between the vitality of the conversations there and the policies that are
Right.
actually coming out of those meetings. And we can talk about that at the international level and at the local level here in
Of
our
course.
own communities,
Of
at
course.
state levels and at our national levels.
Absolutely. Well, of course, this brings up the issue of becoming involved and even politically involved. It seems to me that it's not something we can take sitting down anymore. It's just not something that we can leave for others to do. And as you talk about the youth and how demoralized they're becoming, it seems to me we put a lot of pressure on the younger generations. That's sort of what we do and think, oh, they're going to save us. They're going to do something about this. Well, it seems to me that's not an effective strategy right now.
It's not an effective strategy, and it's not a moral strategy. It's not what we can do. Oh, here, you guys clean it up. We
Exactly.
made the mess, now you guys clean it up. And I don't mean we made the mess individually, because I don't believe that we can put this on individuals and on our individual. These have been policies and drivers through our society for decades, since the
Yeah.
beginning of the Industrial Revolution, and is
Yes.
hugely connected to our fossil fuel addiction and the
Yes.
profits from the
Yes. Of
fossil
course.
fuel industry.
Of course.
But we can't just say, oh, you young people, now you're going to inherit the world. And
Right.
I think what's important is the intergenerational connections and activism around this. And there are many groups across the generational spectrum that are very involved. Elders for Climate Action, Third Act are the groups that organize, particularly among those people with gray hair like me. But that intergenerational involvement is so essential, and not isolating it out to any group. You said involvement with politics. Politics is kind of a dirty word for some people, and
Yes.
it's hard for health professionals to think about themselves in terms of actors in the realm of politics.
Yes.
And I think when we say politics, what we kind of associate now with left, right,
Right.
blue, red,
Yes.
purple, whatever color scheme we want to do.
Yeah.
That's not what I mean about politics.
Okay.
What I mean personally about politics is that the most important things, and there are things that we can all do across our own individual lives in our community, but the most important thing, the thing with the biggest oomph, is policies.
Okay.
And policies don't emerge out of the sky.
Mm-hmm.
Policies emerge out of the leaders who we choose.
Exactly. Right.
So who we choose as leaders,
Right.
and policies that design strategies for intervention at the local, state, national level. And then policies always are created by who we elect. So elections are essential components. And one of my colleagues and many people who are involved in this say voting is a social determinant of health. Voting is an essential thing to do if we are going to have an effective voice in making solutions. It's not the only thing,
Right.
because then we need to follow up with our elected officials and educate them and create the effective policies and help to get those passed and sustain and protect the regulations that emerge out of that. Policy is essential, and politics doesn't have to be thought of as a dirty word.
Yeah. Well, that's so well said. And I think you're right. This is clearly not a left or a right issue. This is a human issue. And I think that we have to probably be a little better as an electorate at not electing climate deniers. I mean, we may not be electing people who are A++ on this issue, but at least people who are open-minded and we can work with, it seems to me, is so important.
I think that's really important. We really have to be educated and knowledgeable about who the candidates are, and think about and selecting and actually voting, because now we have
Right.
a whole group of people who think it's not worth it to participate in our election politics. It's hopeless. That doesn't have to be.
Right.
And knowing what our candidates think about this and will do. And I don't think we're anymore at that stage of climate deniers so much, although there still are, but more a kind of greenwashing. So go beneath the surface. But I think that this is really important, and it's going to be really important for the next year. We're going into a major election cycle.
Right, and this intersects what we talked about a minute ago, the sense of hopelessness, demoralization, maybe giving up. And I think you're right that people who don't vote because of this, and there's a lot of efforts out there to suppress the vote. That's a whole other issue. But I think you're right. We need to take our voice seriously and our voting seriously. And one of the things that occurred to me too, as you were talking about the idea of political activism in this sense, is that there's a positive mental health aspect, feeling like you are doing something, that you can do something, that you have agency and you have a voice. Those seem to be positive things.
Absolutely. I've often been asked about hope
Mm.
and where do I derive my hope? I don't think about hope. I think about what needs to be done now. And it has been said that hope is a verb. You experience hope with activism and engagement. And so I think that's really important. Activism and engagement, and not alone. That means being connected with others in an interconnected way. And that can happen in many different ways. It's not all of us are going to be out there in a kind of advocating for policies and talking to legislators and, waving,
carrying
to
signs,
this and that. Activism can be at many levels.
Okay.
Let me just tell you a story. I'm in Montana now.
Yes.
In Montana, there was an extraordinary legal case where the youth of Montana sued the state of Montana for obstructing their constitutional rights to a clean and healthful environment. That's embedded in the Montana Constitution.
My goodness.
And that occurred this last summer. It was unbelievable. And the youth who brought this case talked about the experience of being frightened and the impacts of climate change to their lives. But if we talk about activism and engagement, these youth tied their incredible sense of mental well-being with their coming together in this particular legal suit. It's called Held versus Montana. But one of the youth at the trial talked about one of the activities that she did in her community. Her community was rebuilding the school. It was a middle school, and they didn't have enough budget to put solar panels on the school.
I see.
This didn't make sense to this middle school aged young girl. What do you mean you don't have the money to put solar panels on? She organized her community. She raised the money
to
get enough funding for solar panels on her school.
Incredible. That's incredible.
Action, activism, spreading it to the other kids in school and to her community. It had a huge impact. And she successfully raised enough money. Then it became an administrative nightmare being able to use that money, but let's not go down that road. Or creating community gardens.
Ah, yes.
Getting kids to touch the soil and create community gardens where people come together. And there's one story out of Washington, D.C., where communities developed roof gardens and planted vegetables in roof gardens, came together, grew vegetables in an impoverished area of Washington, D.C. Then people who are used to eating potato chips out of the local market, what do they know what to do with vegetables? Taught each other how to use the vegetables. Came together, cooking classes, developing community integrations and a community sense that developed just out of this project of rooftop gardens. Coming together and creating important ways of controlling one's local experiences are really important. And they spread.
And there again, you're talking about community. We're talking about people getting together and collectively doing something together. And I fear that as we become more divided, as we become more distrustful of each other, this becomes a little harder.
Absolutely. And there are intentional ways to separate us. We must not devolve into experiencing people with different points of view or people living differently than ourselves as the other.
Right. There's a
And
lot of that
find
happening.
ways
Yeah.
to not make those two-dimensional, that's someone I don't trust, so that we can have connected conversations.
Mhm. Well, we need to look for commonalities. It's all too easy to find differences, I think. But this is something, again, as we said earlier, it's not left or right. This is a human issue that affects everyone, no matter where you are. All right.
Let
Mhm.
me switch and
Yeah.
bring up the role of professionals.
Yes, I wanted to
We
get to
as
that.
mental health professionals,
Yes.
we can intervene and have an important effect, I think, at both at the individual level and
Mhm.
what we do clinically in our work settings,
Mhm.
what we do in community or the institutions that we live in,
Yes.
and what we do in the broader society. And we use an anachronism, the CARE model,
Okay.
two A's,
Okay.
RE, clinical, advocacy, and administrative. So at the two A's in administrative is how we organize the systems of healthcare
Mhm.
delivery and mental health delivery
Mhm.
and the places that we work. Research, and for
Mhm.
research, I really mean creating the important contributory questions
Mhm.
that still need to be addressed, not just filling out our CVs with more
Mhm.
publications, but important questions that have impacts. And then the E, education,
Right.
and expanding both in the public sphere and in our professional sphere with our mental health colleagues and with our health colleagues. At the clinical level, I don't think that most people who are concerned about the environment or experiencing eco distress necessarily think that this is an area that they will be welcome to bring their concerns into a setting in with psychiatrists or others. It is incumbent, I believe, on us working with patients to listen carefully and find those moments where this might be an underlying concern.
Right.
Patients don't
Right.
bring up sex or money unless we make it safe.
That's right. That's
They're
right.
not going to bring up their climate distress unless they think it is safe and there is an attuned ear. And we don't have to talk about it only in terms of climate change, that hot word, but making sure your patients know that there will inevitably be heat waves, and are they protected and do they know what to do? Are they protected and prepared for potential disasters? Just in the same way that pediatricians ask about seatbelts and those protective things. It's incumbent on us to create the environment in our clinical settings and bring this up with actual tools for protection. And then beyond that, there is a limit in our one-to-one model of both efficacy, and we don't have the workforce to deal with this on a one-to-one model. So we need to expand our paradigm of thinking to a much more public health one and develop a community-based model. And then if we only leave it in a one-to-one model, we don't provide that interconnectivity and exchange and normalizing that people get from those group experiences. So things like climate cafes or Good Grief Network that bring people together to talk about their experiences in safe ways, I think is also really important and enhances and avoids the experience of more isolation for many people. That's different than what I said earlier when we have to also be attuned to the severity of symptoms.
Yeah, absolutely. And I think it's interesting you brought up sex and money are things I was always trained to have an ear to and to bring up in a very non-judgmental sort of
Yep.
normalizing way. And I think maybe this is the same thing here. And as we talked about earlier, to normalize appropriate emotions and reactions to this, but have that ear out for when it becomes pathological.
Right. Or
Um,
introduce it. Let me just say, I developed a toolkit, how to survive during heat waves.
mhm,
And it's on our Climate Psychiatry Alliance website in the
mhm,
resources section. I developed that with colleagues at the University of California, San Francisco in the Earth Center. And it is not rocket science. There's
mhm,
nothing like brilliant about it. What my intention is, if you don't prepare and think about what you're going to do ahead of time, or heat waves or disasters or any of
right,
these, you
right.
won't use those.
I
And
see.
so it is designed to give patients and the public things to know what to do.
Mhm,
But it's also designed with the intention of giving clinicians a tool.
mhm,
You're not going to open something up if you don't think you have something that you can help people with.
mhm,
So here in your back pocket, you've got this thing. And so, Mrs. Jones, I know that you live in an area, and we all do, where there's going to be heat waves. I want to make sure, and you can say this in April, your session's in April. Are
sure.
you prepared? Have you
Right.
thought about this? This is in my back pocket here.
Yes.
These are some tools. So it's for clinicians and for the general public.
So what we're saying is, look, climate change is here, and we need to not be in denial of that, and that there are things we can do to think about and prepare for this. And again, that provides a sense that to fight that helpless feeling, a sense that I can do something about this and I can prepare. You mentioned the Climate Psychiatry Alliance. I would like to talk about that a little bit. Can you tell me a little more about how that came about and the kind of work that you do there?
Well, I started telling you it early on that when I got into this, there were like, whoa, we're not talking. We mental health professionals need to be
Right?
talking. So I ended up meeting and finding like-minded psychiatrists
Mm-hmm.
who were also struggling with this in isolation and
Mm-hmm.
needing to say, we need to take this on. And we came together and we formed this nonprofit, Climate Psychiatry Alliance, with the intention of learning and educating and developing an advocacy around the climate health and mental health interface, the climate change and mental health interface. And we began small and taught ourselves, and then we knew we had to have an impact in our
Mm-hmm.
professional association, the American Psychiatric Association. We
Mm-hmm.
knew that would have the largest access to psychiatrists who at that point in time thought, oh, this is an important idea, but it's not in our lane. That
Mm-hmm.
isn't true now.
Right.
That isn't true. And
It's
so we
here.
work within the American Psychiatric Association. We are still
I see.
completely separate,
Got it.
but have an impact and overlap. And in the American Psychiatric Association, there's now a permanent committee on climate change and mental health
I was
to
going to
use
ask
our
about that.
professional association.
Yeah, that's great. I was going to ask about that.
In our Climate Psychiatry Alliance,
Mm-hmm.
we now have a membership of over 1,000.
Mm-hmm.
We do talks, we do advocacy, we do lots of stuff. We're going to spend time in 2024 developing our member engagement and hoping to develop local hubs where
Mm-hmm.
people in regions can come together to
Mm-hmm.
feel that sense of connectivity, which we
Mm-hmm.
have less ability to do when we're only national. So the Climate Psychiatry Alliance has become basically my home and my
Yeah.
second career.
Now, is there a website people can go to?
Absolutely.
What is that?
ClimatePsychiatry.org. It
Okay.
has educational materials, it has
Yes.
resources, it has
Yes.
learning areas, Absolutely. And it also has where you sign up to be a member, and also
Sure.
our donation link,
Very
because
important.
we're very, regrettably, it takes some funding to be able to operate.
Of course. So climatepsychiatry.org. And that toolkit you mentioned earlier, is that on this website, or is there somewhere else
That
I
is
can find
on that website. It's in the resources section, as there are others, and we are developing other resources. And our group is also we've got working groups. One of the most recently developed is our child and youth group, because we
Oh,
know
yeah.
that is so essential. And you're not going to find a robust material on our website, but we are in the process of bringing that to the website. But I want people to know working with youth and children is core and so important as we attempt to protect the world for those who come next.
Sure. And is there, likewise, is there information on the elderly here? We talked about the two age extremes.
Yes, there's some elderly impacts. They're both there. And we will be developing some resources on sample talks so that others can take this on into their own communities.
Well, that's very important, as we said, this idea of advocacy, of raising awareness and education. So we have a role to play not only with our individual patients, but also a little broader than that. And, some people have more or less interest or tolerability for doing those kind of things. But I think that we all have to find our niche. We all have to do what we can do here.
Yes, there is a place for every single one of us. And you might not choose to do what I choose, which is live my life around this. There is a place for everyone in small ways and big ways. I often say, do the thing that's closest to where you work or live or what your passion is.
Yes.
If you expand from where you are, they're small things. Teaching, clinical, community, close to where you already are.
Well, hopefully we've raised awareness with this podcast, and we've given people some ideas, some tools, some resources with climatepsychiatry.org website. And Robin, I just want to thank you for a terrifically interesting and enlightening discussion here of an issue that probably a lot of us in the mental health field are only vaguely aware of and haven't really connected the dots. And so certainly I know you've opened my eyes, as I mentioned, to all the different wrinkles and aspects of this, and to why it is so important for us and how we can be involved in a positive way. So unfortunately, we're running out of time here, but I really want to thank you and just say, do you have any final words of advice perhaps to our audience?
Engagement, 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 vote.
Voting, yes.
And that this is a part of what we all need to be attentive to as we think about protecting the world for ourselves and for those we love and for the future.
Yeah, I think voting is not a nasty word either, and I think we probably need to talk with our family and our friends and encouraging all of those around us to vote, so acting locally and getting involved in whatever way they can. So again, Robin, I really want to thank you for your time.
It's a pleasure talking to you about this.
Likewise. And I want to thank you, the audience, for taking time to listen and to think about these issues with us. For, of course, more information and more educational products and activities that we have, please go to our website, which is the Neuroscience Education Institute website, NEIglobal.com. For more podcasts on a variety of topics, you can find us wherever you get your podcasts. And so I want to thank you all, and I want to wish everyone the best of luck with your clinical work and with other activities you're involved with. Thank you very much for listening.
Thank you for joining us for another episode of the NEI podcast. Please let us know what you'd like to hear more about by leaving a review. Don't miss another episode. Subscribe today. For more information about NEI and our premier educational content, please visit NEIglobal.com.